All right, welcome to Buffalo First Wealth Management, our annual Medicare 101 with our presenter, Maria Shank from Sheridan Benefits, located in Williamsville, New York. As a quick disclosure, this is not intended to be a sales pitch and not endorsed by Medicare or the United States government, and also New York State. So hopefully that was a quick disclosure that will keep us safe. And without further ado, I'm going to turn it over to Maria.
Good evening, everybody. As Ellen mentioned, my name is Maria Shank, and I am with Sheridan Benefits. Just to give you a quick overview, Sheridan Benefits is a full-line brokerage firm here in Western New York, offering most but not all plans here in the area. So today's presentation is purely educational on the Medicare basics. If anyone does have questions and would like to set up a one-on-one appointment with me regarding specific plans or options, my contact information will be at the end of this presentation, and we are happy to help beyond the basics here today. So this presentation is going to give you an overview of Medicare and what is out there to accompany Medicare. So I want to start with first, what is Medicare and who is eligible? Medicare is the federal health insurance program provided by the federal government. So anyone that is 65 years of age or has been on disability for at least 24 full months is eligible for Medicare A and B. And I'm going to be breaking down what the specific parts are and what they cover here as we go through the presentation. So in order to be eligible, you do have to be a citizen or permanent resident of the United States, and you or your spouse would have to have worked 10 years or 40 quarters to be eligible to receive Medicare Part A at no cost and to enroll in Part B. So I want to start with Part A. What is it? How does it work? What does it cost? Part A is the portion that you do not pay into if you've completed 40 quarters or 10 years or 40 quarters in working hours. Medicare Part A covers your inpatient hospital care, skilled nursing, home health care, and hospice care. If you have just original Medicare and no other insurance coverage to wrap around it, and you get admitted into a hospital for 2023, your deductible will be $1,600. That's just to walk into the hospital. I'm sorry, for some reason, my computer has a timer and it's going to keep jumping. So I apologize in advance for that. You're going to pay $1,600. That doesn't include all the a la carte stuff in the hospital. So there's another 20% fee for that stuff. The $1,600 will cover you for days 1 through 60. God forbid you are in the hospital beyond 60 days. You begin to pay $400 per day. So just by looking at these numbers, you'll see that Medicare could add up quickly, which is why we're here to assist you to help you find something that can help offset these costs as your needs begin to get bigger and bigger. This is the fun part for me because this is the first time in almost 15 years that I can say Medicare is going down. So for 2023, the Medicare Part B premium will be $164.90 if your income is less than $97,000 for a single person or $194,000 for a couple. Now, I want to elaborate on that for a moment because when they are looking at these rates, they are looking at 2 years prior. So if you are turning 65 in 2023, they are going to be looking at your 2021 income. This is the modified adjusted gross income that they look at. So if your income is above these amounts, you could pay a higher premium for Part B. And it is broken out into several income brackets. So depending on where that income falls would determine what that cost will be. Your financial advisors here, Alan and oh my God, I just drew a blank. I'm so sorry. They can help you with determining what that income looked like and what is considered income, especially if you're drawing on IRAs and things like that. So work with your financial advisors to determine what your modified adjusted gross income is for your tax preparers. Part B, as in boy, covers anything outpatient. So things like your doctor's visits, lab work, same-day surgery, durable medical equipment, those are going to have a deductible of $226, after which you pay 20% of the cost of the service. So again, Medicare does have cost shares in the forms of deductibles and coinsurance. With Medicare, there is no cap to your out-of-pocket expenses. So no matter how many services you're getting done at the end of the year, you're going to continue to pay right through December 31st. Your Medicare Part B premium can change each year. So that's why I said I was excited to say this year was the first time it went down. This is reviewed at the end of every year. So keep that in mind. When it comes to Medicare, your costs are your Part B premium, your deductibles, and your co-insurances. So what we do to help you offset some of those costs for your services is we look at what's called Medicare Part C or a Medicare Advantage plan. These types of programs work, they become primary to Medicare. So what happens is by you paying your Medicare Part B premium, your premium gets turned over to whatever health insurance company you enroll in. That health insurance company then provides all the services to you as the primary provider. So if you have your Medicare A and B and you have XYZ health insurance company, your Medicare card, that goes with all your important paperwork. You don't need to show that. You're going to present your health insurance card to the providers when you go. So if you're going to see your primary care doctor, you're going to pay the copayment for that health plan versus the $226 deductible with Medicare. So you go to the doctor, it has a $10 copay, you pay that copayment at the time of service. These plans not only cover your medical, but they are going to cover things like vision, hearing, dental, wellness programs. These plans have an annual out-of-pocket maximum. Why is that important to mention? A few minutes ago, I said Medicare, like the Energizer Bunny, you keep paying and paying and paying through the end of the year. These plans, due to the Affordable Care Act of 2010, have an out-of-pocket maximum protection so that in the event of a catastrophic illness, you are capped at what your financial responsibilities will be. When you enroll in an Advantage plan, you always continue to pay your Medicare Part B premium. When you're looking at an Advantage plan and you're trying to determine what the right type of coverage is for you, what you want to look at is you want to look at where do you go to get your doctor's services? Is it within the 8 counties of Western New York? Do you travel to the Cleveland Clinic or the Mayo Clinic for services? Are you a snowbirder that you want to go to Florida or Arizona for the winter? Those are the things you want to consider when you start looking for your plan. Why? Because if you look on the bottom here on the second half of the screen, these are the types of programs that are out there. The first one being an HMO, which is your health maintenance organization. With these plans, you are required to see a doctor in network for routine care. Most plans here in Western New York in network are the 8 counties of Western New York. Anything outside could and will be considered out of network. There are some exceptions to the border counties in Rochester in northern Pennsylvania, but like if you wanted a second opinion at Cleveland Clinic with an HMO plan, it would not be covered. A PPO is going to give you a national network advantage. So you can go anywhere in the US to get coverage. If that doctor accepts that particular PPO plan network, you pay in-network copayments. If they don't accept the network copays, you would still be covered, possibly at a higher cost share, but you can still get that routine care done by a non-network provider. There aren't too many private fee-for-service plans left in the area, but there are some. A private fee-for-service plan, the doctors could either take or not take the plan at time of service. So they could potentially decline service when you're going, or they could take it the next day. So that one's a little bit undefined when it comes to a network. A Medicare savings account plan is similar to a health savings account plan that you may or may not have had when you were working. These plans, Medicare pays so much money up front towards your services. Once that amount is met or reached, you then start paying co-payments. And then there's the special needs plans, and those are really for people that are living in a skilled nursing, or excuse me, a nursing home. Those are the institutionalized skilled nursing or special needs plans. There is the chronic illness one. So there's the chronic special needs plans, and then there is one for people that have both Medicare and Medicaid, which is called the dual special needs plan. So it's important just to kind of think a little bit when you're trying to determine what's going to work for you, to know what exactly you want to go for when it comes to selecting your plan. And then there is Part D as in David, which is the prescription drug benefit. With Medicare Part D, it's important to know you can get it in one of two ways. You can either get it through a Medicare Advantage plan or as a standalone drug plan. If you're looking to get a Medicare Advantage plan, there are plans out there that do not have drug coverage. So if you know you need prescription drug coverage, you want to make sure the Advantage plan you're enrolling in it has the drug benefit, because you cannot enroll in a Medicare Advantage plan without drugs and then pick up a standalone drug plan. Whichever one you enroll in second kicks you out of the first one. So it's important just to keep that also in mind when you are shopping for your plan. If you don't sign up for prescription drug coverage when you first become eligible, you could face a late enrollment penalty. That penalty continues to accrue until you enroll in a plan. So if you were somebody that became eligible January 1st of 2020, and you didn't take out a plan because you weren't on any medication, now you go for your annual physical and the doctor says, you have high blood pressure, high cholesterol, and you're a diabetic. And now you walk out of the doctor's office with 6 medications. And you're like, oh God, I need a drug plan. Now, when you go to enroll in that drug plan, you are going to be charged a late enrollment penalty for all the months you went without it. If you enroll for January of 2023, you've now been 36 months without coverage. So they take 36% of the national average, which is about $44, and they add that to the monthly premium of the plan you went with. That premium stays with you forever. It's not a one-time penalty, it's a lifetime. So just keep that in mind, especially for those of you that are just becoming eligible for Medicare. You know, our biggest proponent here is education, and we want to make sure you avoid all of these unnecessary costs when the time comes. Do it as the timeline prevails so that you're not paying any extra penalties or fees. One thing I want to...
Maria, I think Kathy has a question. She got her hand up.
Oh, yeah, sure.
Kathy,
Go ahead.
you got it on mute.
Thank you. Yes. Can you hear me?
I can.
Okay. Except if you're still working and still covered by the corporate plan?
That is correct. And I'm actually going to be touching on that in just a few minutes.
Okay, because you almost made me change my underwear here.
Oh, sorry. No, I'm going to be getting to the point where, because the same holds true for Medicare Part B, if you don't take that out because you're working. So I'm going to walk you through that stage if you're already retired versus still working and getting it past the age of 65. Okay. One thing I do want to point out is A and B come from the federal government. C, which is the Advantage plan, and D, which is the drug coverage, come from the private insurance companies. So just keep that in mind when you're going online or, you know, trying to apply for your Medicare. You're not getting the C and D through the same avenue that you're getting the A and the B. The one thing I want to help people understand is the Medicare prescription drug coverage, what the different phases are, and what the heck does donut hole mean. So we hear that word a lot. They actually did away with that word and they call it the coverage gap. So when you're looking at a Medicare prescription drug plan or Part D, there are 4 phases to the program. The plans typically have a deductible of some sort or for some tiers. Most of them will have a deductible for your brand name tiers 3, 4, and 5. Once that deductible is met, you go into the initial coverage phase. That is where you pay the plan copayment. So whether it's a $5, $20, $45 copayment, you pay those copayments until you reach the initial coverage limit, which is $4,600. That is what you pay and what the health insurance pay combined. If you reach that initial coverage limit, you go into the coverage gap or the donut hole. This is where you will pay 25% of the cost of all medications. You pay that 25% until you hit the out-of-pocket maximum, which for 2023 is $7,660, if my memory serves me well right now. The way that it works in the coverage gap is, I'm going to take a step back, because any money you've paid out of pocket, your deductible and copayment, have all been subtracted from that amount of $7,660 already. So let's say you've paid out $1,500 already. Now your out-of-pocket maximum is down to $6,150. When you are in the coverage gap, whatever you are taking out of your pocket for generic drugs and paying to the pharmacy comes off of that. Whatever your total cost of a brand name drug is comes off of that final amount. So let's say you're going to the pharmacy and you have a $400 drug. You're going to pay the pharmacist $100 or your 25%, but the full $400 is coming off of that out-of-pocket maximum. So at the end of the day, if you reach that $7,660, you have not physically paid all of that out if you have brand name drugs, which is good. But then you go into catastrophic coverage, where you pay no more than 5% for whatever drug it is, whether it's generic or brand. So this tends to be the most complicated portion of Medicare altogether, is understanding what your prescription costs are, knowing if or when you're going to go through or pass any of these phases. One of the things my team does for our clients, anytime we sit with anybody, we have you bring your list of drugs and we run a drug report for you based on the plan you enroll in, so that you can have an estimate. And I emphasize estimate, because when we pull that drug list, that could potentially change if the manufacturers change the cost of the drugs throughout the year. So we do stress that it's an estimate. It's not going to be to the penny, but it's pretty close to give you an idea of what your out-of-pocket costs are going to be. Because prescriptions are so costly and very important to everybody, there are programs available that you could qualify for to help offset some of the costs to you. One of them being the New York State EPIC program. New York is only one of 11 states that has this type of program. And this is based on income. So you do have to be 65 years of age. You have to live in New York State. Your single income cannot exceed $75,000. Your married income cannot exceed $100,000. With EPIC, they look at your gross income and they look at the year prior. So if you're turning 65 in December and you want to enroll, they are going to look at 2021's income. So this is a program that can help lower your monthly costs for the premium, as well as your co-payments based on your income. If you served in the military, you could be eligible for VA benefits and get your prescriptions at a discount through them as well. And then based on your income, you could potentially qualify for the low income subsidy plan available through the government. So these are just some of the programs that we review with all of our clients to see if we can get them help paying their prescription drug costs. Any questions so far before we get into how to enroll in Medicare and all in the exceptions to the rules? No? Okay.
Actually, Maria, I do have a question.
Sure.
I think people get confused sometimes when you talk about, especially in the first slide where it said skilled nursing facilities,
Mhm.
and people think that their Medicare covers nursing homes.
You are correct. We get that all the time. So it is specific to skilled acute rehabilitation. So just to give you an example, if you have a hip or a knee replacement or cardiac surgery, and you have to go to a rehabilitation center like a, Greenfield or McGuire Group, and you're there for maybe anywhere from 5 to 10 days, that is the skilled rehabilitation we're referring to. They only cover up to 100 days. So if you go into a skilled rehabilitation and you exceed 100 days, you're considered long-term care. That is where Medicare stops. For anybody that is in a nursing home, to get actual coverage, you would need to look into a long-term care insurance policy. No health insurance and no Medicare cover the admission to a nursing home for long-term care.
Thank you.
You're welcome. Okay, so how do you apply for Medicare when you're ready? So those that are already retired and collecting Social Security, you don't have to do anything. Your card will automatically get mailed to you 3 months prior to the month you are eligible for coverage. So if you have a birthday of October 15th and you're drawing Social Security already, in the month of July, you will receive your Medicare card in the mail. If you are turning 65, still working, or you are not ready to collect Social Security, you would contact the Social Security Administration either by phone, you can apply online, and I really need to fix this a little bit because only some locations are seeing people in person. So you do need to contact your local office to see what their in-person hours are. Most of them have limited hours right now. Some of them, like the one on Exchange or on Main Street downtown, only sees people 1 day a week for 3 hours. So
I
it's
think
limited.
Niagara Falls is very similar. Those are the only two that I think that are open for in person.
Well, West Seneca is fully reopened. You can actually,
is it? Okay.
Yeah, you can just walk into West Seneca, which is crazy to think that, but yeah. So it's each location's a little bit different. You have to contact the site. I will say if you are computer savvy and comfortable, going to ssa.gov is the easiest way to enroll, and it's the easiest way to track your application to be if it's been processed or not. So there's 3 ways you can do it, and that again is if you are not collecting Social Security. So the one thing I want to point out, and this came up earlier, is how do you know if you need to apply for Medicare or if you can decline it? So if you are working past the age of 65, and more we are seeing this happen, if your employer is under 20 employees, so you work for ABC Company, there's 9 employees, you're turning 65 in January. Because there are less than 20 employees, Medicare says it's not as good as our government plan. You need to go on Medicare to avoid penalties. So you would pick up your Medicare A and B, and then you have the choice to either use your employer's policy as your secondary coverage or take out a Medicare Advantage plan. I will say, in most cases, going on your own is typically less expensive based on what you may or may not have to contribute to your plan. If you do not take out Medicare and there are less than 20 employees, the insurance company could deny the first 80% of your claims. So please know whether or not your employer is over or under 20, especially if they're right on that cusp, because you could be held liable for the first 80% of your claims if you don't take out Medicare when you should.
Now,
Now,
is there,
go ahead.
I was going to say, there's a lot of full-time, part-time, or FTEs and PTEs. Does any of that come into play, or is it all just personal heads in that business?
So there has to be 20 full-time equivalents on the W-2s of the company.
Okay.
So most of the time, it's usually, when you have the seasonal companies, that's really where you have to check and make sure. Like, I have a client every year, he's got to double check with his employer at the first of the year because he's a landscaper. And during the summer, they're well over. But come the winter, there's no employees. So it's got to balance out for the year. So just make sure you check with your benefits administrator or your HR person to ensure that you know for sure that your company has more than 20 employees. Because if it does, you do not have to apply for Medicare Part B or Part D. So if you are working for XYZ company and there's 120 employees and you only pay 80 or 60% of your health insurance, which is less than the Medicare Part B premium, it makes more sense for you to stay on your employer plan, especially if you are covering dependents, if you have your spouse or children on there. Because what we are finding more and more of, the insurance companies are no longer allowing employers to cover a spouse if the employee comes off the plan to go on Medicare. So it's important that you have these conversations with your benefits administrators before you come off of a plan, especially if you're covering dependents. So over 20, you can decline Part B. You do not need to pick up Part D. So the question came up earlier. What'll happen is if you're working and now you turn 70 and you're like, okay, I'm going to retire, but I haven't taken out Medicare Part B yet. You're going to be okay because your employer is going to fill out what's called a request for employment verification form. That is going to tell the government that you have had insurance coverage through your employer, who's attesting to have had more than 20 employees. You will not receive the Medicare Part B enrollment penalty. Your employer is also mandated by law to give you a certificate of credible drug coverage each year upon renewal. That letter states whether or not your prescription drug coverage is as good as or better than Medicare Part D. As long as you've received that letter each year, you will not receive a late enrollment penalty because you had credible coverage through your employer. So again, you just want to have that conversation with your benefits administrator or your HR provider to ensure what you need to do at that time. If you're not sure, I'm always available as a resource, and I'm happy to help have that conversation with your employer to make sure that you're doing the right thing at the right time to avoid any unwanted penalty.
So I got a question for you.
Yeah.
I'm 65 years old. I got credible health insurance. Let's say my employer is over 20 people. And do I have to take Part A as well if I got good coverage through my employer? Or
That's
is
a
it
great
just
question coming from a financial advisor, because if you are in a health plan through your employer and you are contributing to an HSA account, a health savings account. You do not want to apply for Part A, because
Okay.
if you do, you can no longer contribute to your HSA account, neither can your employer. If you're working for a company and you have a Cadillac plan, no HSA, it doesn't hurt to apply for Part A. It's not going to harm you in any way. It's just going to kind of hang out there in the back corner and just sit there and wait till Part A comes around to, join the party, or Part B.
So if I don't know, you're probably going to touch on this, but what if I'm collecting my Medicare and I enroll in the Part B, but I'm not taking my Social Security yet because I want to wait until my full age or even 70 to max that out? How do I pay my premiums then if it's not coming out of my Social Security check?
So the way that it works is, if you do not draw Social Security at the same time you take out your Medicare, Social Security will bill you quarterly. So you will get a 3-month bill at a time. Now, depending on when your birthday is, it could be 4 or 5 months for the first one, because they always got to play catch up with the next quarter. So you will be billed directly for your Medicare Part B premiums until you begin drawing your Social Security. So if you're going to wait till 70 so you can get the biggest bang, they will begin to withdraw it from your Social Security. Now, I want to point this out, because if you are not drawing Social Security, and let's say there's no cost of living increase in the Social Security payments, if you're drawing a Social Security benefit, they cannot increase your Medicare premium. Those that receive a premium bill for Social Security, their Medicare would go up. So there's different rules on when and how much they can increase Medicare, and it typically goes based on the cost of living for Social Security. So this year, I believe it's 8.7% you guys are going to see in the Social Security increase. So if you're not drawing it and they hold those people harmless that are drawing, your Medicare premium can still go up. So just keep that in mind. If you're not drawing Social Security and you're wondering, why did my neighbor's premium not go up, but mine did? That would probably be the reason why. But again, this year it's going down, so everybody's safe, especially me.
Kathy, did that answer your question? I hope.
Yes, thanks. Yeah, I did have to check with my husband's employer with his coverage. He works for a school system, and I'm covered by his plan. And I was recommended by another advisor to call them and make sure they would cover a spouse on Medicare, and they did certify that.
Yep. And most of the
Nice.
school districts will, on the retiree benefit, the comment I made earlier about spouses not being covered is, let's say you and your spouse are still employed, or he's still employed with the school district, and then he comes off to go on Medicare. Companies are not being able to cover a spouse on the active employee plan once the employee comes off the plan. So in your case, because you're both on the Medicare plan, they would still continue to cover you because it's a retiree benefit. With the Medicare Advantage plan, there are only certain times of the year that somebody can enroll. The first enrollment period is your initial enrollment period when you first turn eligible for Medicare. Your enrollment period starts 3 months before, the month of, and up to 3 months after. We have the annual enrollment period that we are in right now that runs October 15th to December 7th. Coverage will begin the 1st of January. And then there are special enrollment periods throughout the year. Some of the more common ones are if you move in or out of the service area, if you're voluntarily coming off of an employer group plan, if you are a New York State EPIC member. I had mentioned the New York State EPIC program. That gives you a special enrollment to change your plan one time outside of the annual enrollment period. There's a special enrollment for 5-star plans. So I'm sure you guys have all seen the 1 or 2 Medicare commercials out there. And you may hear the term 5-star plan. Any plan that is 5-star, you are allowed to change into one of those plans anytime within the calendar year. You can only do it once. So if you're with company A and you decide you're not really happy with it and company B is a 5-star plan, you can jump into that plan at any time throughout the calendar year. So just keep those, special enrollments in mind. You're not always locked in till the next annual enrollment period. There are some situations where you do qualify for that special enrollment. Okay. And then the last thing I want to cover is a Medigap plan. And these plans are a little bit different than the Advantage plans because these plans only cover what original Medicare covers. So things like a routine eye exam, routine hearing exam, prescription drug coverage, vision, dental, hearing, none of that is available with the Medigap policy. These policies are written by New York State. They are designated with letters. So we have the Medicare Advantage plans, they all have names. The Medigap policies have letters. They offer A, B, C, D, F, G, J, A, B, C, D, G, J, K, L, M, and N. So there's different plans with different coverage. The plan G as in girl, it's going to be your most comprehensive, where it's going to have the highest monthly premium. It's going to have your Part B deductible of $226. But then once that deductible is met, everything's covered in full. So it's a different type of policy. This policy has no network. A lot of people like these types of plans if they are travelers because they can go anywhere in the US. The doctor just has to accept regular fee-for-service Medicare and your Medigap has to pay secondary. This is one time where you would pick up that standalone prescription drug plan to offset your prescription drug coverage. So it will work with a Medigap plan. And again, as I mentioned, you still continue to pay your Part B premium, but they work just a little bit different because remember I said in the beginning, you put your red, white, and blue card away for the Advantage plan? With these types of plans, you have to show your red, white, and blue card as primary, your Medicare card is second, or your plan card is secondary, then you have a third card for your prescription drug coverage. So what we do is we always kind of have a conversation with our clients, see what their needs are, see what their wants are, see who their network of doctors is to help determine what would be a better fit. Does your needs meet the Medicare Advantage plan or the Medigap policies? So we would help you decide on what you think would be better for you. And with that, I am going to say thank you all for listening to me. And I'm going to open it up and see if anyone has any additional questions that we may not have covered.
I have a question. So I know you're not allowed to have two Medicare policies at once.
Mhm.
So if I have to pick up a prescription plan, is that different than a Medigap plan?
It is. So you can't have a Medicare Advantage plan and a Medicare Part D plan together because
okay.
they are primary to Medicare, where the
Okay.
Medigap, Medicare's primary, so you can have that drug coverage, plus it doesn't have the drug benefit in there.
Okay.
And the
'Cause,
one thing, go ahead.
No, I was going to say my wife's uncle worked at General Motors, and for the retirees they gave him a prescription drug plan,
Mm-hmm.
and he enrolled in the Medicare Advantage and got denied because he was already enrolled into a Medicare drug plan. So it was a whole mess, but finally got it straightened out and learned a hard lesson on that one.
Yeah, and if you have an employer group plan, talk to somebody before you jump off of it because typically, once you come off of that employer group plan, you can't get back on it. And then the other thing I want to point out is I get this question a lot. Can I have a Medigap and a Medicare Advantage plan? The answer is no. It is actually illegal for us as sales representatives to even sell you both plans. You can't have both.
Now, do some of the Medicare Advantage plans cover me if I go out of state? Or is
Yes.
that really, so the PPO plan, you'd want to make sure you enroll in a PPO plan and not an HMO plan if you're traveling. If I have a house down south, or us being in New York, snowbirds going down south.
It really depends on the frequency, because like my parents go to Florida for about 4 months out of the year. They're still on an HMO plan because, knock on wood, they're still fairly healthy. Now, I'm not going to tell you my dad has not used the urgent care frequently down there. He has. You are covered for urgent and emergency care worldwide, no matter what type of Medicare Advantage plan you're on, whether it's an HMO or a PPO. The difference is if you're getting routine care. So what I always tell people, if you're somebody that is on a blood thinner and you have to get blood work done every 2 weeks or every month, however, whatever the frequency is, somebody in that case who does travel outside the area for at least a month at a time, you're going to want that PPO plan so that those blood draws are covered wherever you are. But if you're, fairly healthy individual, you just kind of go and come and, you're just using the doctors for routine or maintenance, you may not need to pay for a PPO right now, knowing that every year you can reassess what your medical needs are.
Good. I'm gonna stop sharing for a second. So when it comes to, you see on TV, zero premium plans, I'm assuming those are more like a high deductible plan. For if I've got a high deductible plan, I'm looking at the zero premium, I'm expecting more out of pocket costs, correct?
Not
Or is it different?
necessarily. The zero premium plans that are on the market are pretty rich, especially because, again, by you paying into your Medicare Part B premium, those Part B premiums are getting turned over to the insurance company. The insurance companies have to put 86% of the premium dollars back into the plan. So you could actually get some rich products on those zero premium plans. But what we always tell everybody is the premium is just one piece of the puzzle. So I like to put the whole puzzle together before I advise somebody as to what plan might be best for them. So I take a deep dive with every client, looking at how often do you see your primary doctor? How many specialists do you have, and how often do you see each of those? How many times a year do you get lab work? Do you frequently get x-rays or CT scans? And we kind of estimate that all on a zero premium plan versus a premium plan. And we find that balance of premiums versus co-payments. Because when you look at the plans, whether you're paying $0 or $200, the same benefits are covered. What balances out is, as the premiums go up, the co-payments come down. But everything has to weigh out in coverage equally. I know that sounds weird, but it does. So when you paint the big picture, when I get somebody that says, well, I go to the doctor once a year, go for my annual physicals, knowing that preventive services are covered in full on all the plans, probably a good candidate for the zero premium plan. Because again, all the plans are going to have that out-of-pocket maximum protection should something catastrophic happen. And you're never locked in forever to one plan. So everything can be adjusted as your needs change, typically within the annual enrollment period. But again, there are those special enrollments that we can make changes off cycle as well.
Right. And you guys have any questions? No? Well, I want to thank you very much for taking time out of your busy day, especially during open enrollment. So it's not easy to break away, but truly provide a lot of insight for our clients, and we will broadcast this on YouTube. So again, thank you very much, and have a great day.
Thanks for having me again, guys. Have a good night.
Thanks, Maria.
Thank you.
Bye-bye.
Thank you, Maria.
Yes, thank